Welcome, everyone. We're excited to have you here today for our June Advancing Throughout the Year webinar. Today, our guest speakers will focus on career advice in the healthcare, academia, and trades sectors. And now a little bit about Advancing Throughout the Year. LiveWell San Diego works with recognized partners to host a series of webinars and networking events to build on the topics and connections made at the LiveWell Advanced Conference and School Summit. We're here to stay connected, share new insights, learn from our community partners, and continue the important work that we started together. My name is Abby Rollison, and I'm a youth sector coordinator with the County of San Diego Department of Strategy and Community Engagement. I'm honored to be your moderator today, and here's what's on your agenda. We will be having a panel discussion about careers in healthcare, academia, and trades, including some of our pre-submitted attendee questions. Afterwards, we'll transition to a live Q&A session, and we will also have an opportunity for feedback following the Q&A session. Let's get started. A few reminders before we begin. This webinar is being recorded and your lines are muted. Please remember to submit your questions in the Q&A box, which is a button at the bottom center of your screen. If you have comments to share during the presentations, you can input them in the chat box. And if, due to time constraints, we don't get to your questions today and you want to reach back out to our team, you can follow up with us via email at the email address listed on the screen and share it in the chat. We'll also be sending out links to resources, the recording, and contact information in a follow-up email. And if you'd like to receive the recording of today's webinar, please sign up for email updates by scanning the QR code or clicking on the link shared in the chat. We'll also be uploading the recording to our Virtual Connection Hub page, and you can check it out there. All right, now for our career panel. I'll go ahead and introduce our panelists today. Kendrix Reynolds is an education and workforce development professional with San Diego Workforce Partnership. Mazen Michael is a program specialist with San Diego Workforce Partnership. Laura Angel Zavala is a lecturer and faculty leader at San Diego State University. Elisa Romero is a director of ambulatory care services for surgical specialties at Sharp Rees-Stealy Medical Group. And Inez Mello Simpson is a project coordinator at Sharp Rees-Stealy Medical Centers. If you have any questions for our panelists, please put them in the Q&A box to be addressed after the panel. And with that, I'll begin with our first question. So to our panelists, what has been your education and career experience that has led you to your career today? And we'll begin with Laura.
Good afternoon, and thank you for having me here today. My experience has been first generation, coming from a family that did not begin with college, but having parents that was so resilient and always knew how to ask questions that really helped me in my beginning. So I went to Southwestern College, got an associate's degree, then got transferred to San Diego State University, where again, if there were struggles, because I had learned so much from my parents, watching them overcome those things, ask questions, I was able to apply for a master's degree in experimental psychology, and then began working in the community, and that prepared me for the work that I have today here at San Diego State University and opening up my own business. So just wanted to share that. Thank you so much.
Thank you. Next is Kendrix.
Thank you all for having me. Yeah, so I had, well, I guess we'll start. I went to a four-year university straight out of high school as a 17-year-old, and I realized that that was very scary and pretty challenging. So I transferred back to a community college where I really built like my confidence to be able to go on to finish my undergrad and grad school. And if you had asked me years ago what I wanted to do, I would probably tell you I wanted to be a historian. And that passion led me to get my bachelor's and master's in history, and also gave me opportunities to teach at the college level. But as I worked with students, and also like in student services, I really became interested in the things that happen outside of the classroom that affect student success in the classroom. Through tutoring, teaching, my outreach and school relations at Miramar College, museums, public history, and now my workforce development, I really saw that students were struggling with balancing work, family responsibilities, financial challenges, and other barriers that weren't like really visible to educators. So I really shift my focus from just teaching history to helping people navigate those education and career systems. So today I work as a youth program specialist, helping young adults navigate those education and career systems and helping them reach their educational and employment goals. And looking back, all of those kind of really reinforced my belief that education can be transformative if you have the tools, and support to succeed. So, yeah.
Thank you. Next is Mazen.
Hey everyone, my name is Mazen. Um, I, um, I founded my own as a first generation American here. Um, I realized that there are a lot of gaps when it comes to helping underserved communities. Um, so I founded my own community nonprofit in 2017. It's a community youth-based organization for East African youth. What started as a passion project ended up leading into a career path. Um, Before working with San Diego Workforce Partnership, I was working with the San Diego and Imperial County Labor Council. I worked on the nonprofit side of the Labor Council. We helped union members within the communities. So my role was directly to help union members, help people find unionized jobs within the community. Um, but I wanted to be more hands-on with community members, not just union members. That's what led me here to San Diego Workforce Partnership. This job does a pretty good job. This company does a good job of um, bridging those gaps within underserved communities. Not just this company, but this position specifically, because it this company gives us the the space to be able to go into community spaces and not just say we want to help certain communities and certain demographics, but it gives us the opportunity to actually go into those spaces um, and help who we deem um, as who we see fit for these positions. So we can go into we can join spaces like this. We can go into high schools, and we can go into community centers and church spaces, and we can offer our services to people. So that's my roundabout way of ending up here.
Thank you. Next, Elisa.
Hello, everyone. So I actually knew very early on that I wanted to do something that involved helping people. I thought that initially I wanted to be a teacher, simply because I grew up very closely to my aunt, and she was a teacher. But I also had another aunt who was a nurse. And so growing up, being able to see and watch both of my aunts in action doing two separate things, one being a teacher, an educator, and the other one being a nurse, I fell in love with both of their careers and just watching how they made a positive impact on the people, whether it was the students or it was the patients that they were taking care of. And so my first role in healthcare was actually as a medical assistant. And very early on, as I became a medical assistant and got to like really work beside the doctors and help with the patients, I just loved talking to them. I loved getting to know their stories. I loved being able to help them through whatever was happening with them as far as why they were coming to see the doctor. And one situation when I was taking probably a little bit more time than what I needed to by talking to the patient as I was getting them ready for the doctor who was going to come in to see them. I spent a little bit too much time, and when I came out of the exam room, the cardiologist who I was helping, the heart doctor, he got a little bit upset with me, and he scolded me, and he said, he goes, you took too much time with my patient. He goes, and you're not a nurse. He goes, so stop acting like one. And I was like, whoa. But that conversation turned into something so amazing because at the end of that same work day, his boss called me to his office and he goes, hey, Elisa, he goes, I want to let you know something. He goes, I heard that interaction that happened between you, he goes, and he goes, my colleague. And I want to let you know that I agree with him. He goes, you're not a nurse, but you should be one. And he said, and you're not going to be able to make it working full time here in our clinic. He said, so what I'm going to do for you is I'm going to write you a letter of recommendation so that you can go apply over there. And he pointed to the hospital that was across the parking lot. He goes, I want you to take this letter of recommendation. I want you to go apply over there. He said, because the hospital's open 24 hours and you could get an evening or a night job and go back to nursing school. And so thanks to those two physicians, the interaction that I had with the physician and also the conversation that I had with the chief afterwards led me to pursuing going back to nursing school. And thanks to that, I started out as a bedside nurse taking care of patients. And then I fell in love with leadership very early on. And I started to pursue going on from my associate's degree to my bachelor's degree, then to my master's degree all along the while with the organization that I was working in, I took advantage of all of the opportunities, the career and educational benefits that they offered to me as an employee. I took advantage of all of it. And I really absorbed all those career growth opportunities, especially those focusing in leadership, to where I am today. I am now serving as a director for surgical specialties. That means I help handle the day-to-day business operations. I've also been a lifelong learner where, I not only got my master's in nursing, I got my MBA. I'm currently now in my PhD program at USD. So I'm a huge advocate of how important it is that we continue to pursue our education while at the same point always aspiring to grow and learn more in our career. And thankfully, for where I'm at right now, I have the flexibility and the ability to support high school programs and also other college programs when it comes to finding ways on how we can create mentorships or preceptorships within our healthcare organization at Sharp. So that's a little bit about me. Thank you.
Thank you. Next is Inez.
Hello, everyone. Thank you for having me. My career path hasn't all, it wasn't a straight line. It's kind of just been shaped on like a hands-on experience. I didn't go to college right out of high school. I went into the workforce and I've been at Sharp for 22 years. I started an administrative role and, helped do and learn the day-to-day operations. I pretty much grew up there, right? Got married, had kids. When I was 6 months pregnant with my second baby is when I decided to go back to school and get my bachelor's degree. So I have my bachelor's degree in healthcare administration, health management. And just over time, I started to get involved more with coordinating programs, supporting the patient care services team. I currently support 4 directors at Sharp Rees-Stealy and their service lines. I am currently in a project coordinator role. We now do a lot of community engagement. I help support our high school programs and our clinical externship programs. I also just currently started my MBA. So I just started school and hopefully we'll finish that in a year or two or three. We'll see. I'll take it day by day because, you do have to kind of coordinate your life and what you got going on and extracurriculars and school and work. It's a balance, but I highly recommend becoming a lifelong learner. I think it's great. It gives everybody great opportunity. That's a little bit about me.
Thank you so much to everyone for all of those answers. We're going to go to question number 2. What are some other positions within your organization? And what is a job within your organization that people may not know about but should? And we're going to begin with Kendricks and Mazen.
Okay, I'll go ahead and take this question. So with here at San Diego Workforce Partnership, we are the largest workforce company here in San Diego County. And with that, we have multiple ways that we do help people find employment. I think some positions within our organization that people do really do need to know about are there's two. One is our career centers, and our second one is our learning team. We have four career centers spread out throughout San Diego County. We have a North County office, North County Career Center, which is in Oceanside, an East County Career Center in El Cajon, our Metro Career Center, which is in Southeast San Diego, and our South County, which is in Chula Vista. People can go into any one of those career centers. These are all free of charge to anybody who wants to go in and get any type of assistance. Um, you can go in and you can help and you can meet with a career navigator who can help try to place you with you can go in and help and fill out your profiles for San Diego Workforce Partnership, and then we can try to place you within which training program would fit best for you and what your needs are and what you're looking for. Um, and then we also have our learning team, which goes out into community spaces and offers our services to community members. That can be anything from going to putting on our workshops at different high schools, junior colleges, public libraries, community spaces. Our learning team does a good job of helping participants create resumes and cover letters, job interview prepping, which it can be it can be anything from finding out what to expect in a job interview all the way up until a mock job interview. We offer computer competency classes, and that's for whatever skill level you come in with. We can help you advance to whatever career goal you're looking for. And then we also offer essential skills trainings and soft skills trainings. A lot of these professions, the hard skills are the technical skills that are involved in actually completing your day-to-day tasks. But then the soft skills are things like like job application prepping, like resume building, or um, and our learning team goes out and helps people with all that stuff. San Diego Workforce Partnership is a unique company in to where we don't necessarily it's not just you apply and you come in, you get a job and you work day to day. Our jobs are literally to find other people jobs, right? So we're community servants into where when people come in and people come to us when they're looking to better their lives, and our day-to-day job is literally to help people in whatever aspect they're looking for that can help them advance in whether it's to get into a career or advance within their career. And I'll pass it to Elisa, I guess.
Thank you. So the awesome thing about healthcare is that it's not all about just being in a role that involves like having the clinical, like, or having to be like front facing, taking care of the patients, so meaning like being like a nurse or a doctor. We have several other roles which include yes, still taking care of patients would be like medical assistants, certified nursing assistants, physical therapists. And then there's also this other world that happens behind the scenes. And what I mean is that there's positions like in health information. There's also the CI team, which is the clinical informatics team. There's project management. There's business services. There's finance. And so there are so many components and key players that are needed to make the world of healthcare work, that it's so much more than just what we see on TV, like the Grey's Anatomy stuff. There's all these other roles, and some of those are like the ones that I mentioned, like more like on the business or the administrative side. Another cool role that we have at Sharp is cybersecurity. And that is like, up and coming and getting involved in roles that are related to AI or technology. Those are other roles as well that we are starting to see that there's a shift and a need for expertise as well. And so, the world of healthcare is huge and it's open to pretty much anything, even if like you're an engineer. I mean, we need engineers in our bioengineering team. We have a facilities team as well. Security as well. So if you're all about safety. So long story short, the world of healthcare and in the world at Sharp is much more than only about our nurses and our physicians. Those are key roles, yes. And then there's just so much more, which is open to all of you to explore. So thank you.
Thank you. Those were wonderful answers. Next question, please. For current students and those ready to transition from education to work, what experiences would be helpful to gain and how can they attain these? And do you have any advice for those looking to transition into this career from a different career? And we are going to start off with Inez.
Okay. So I encourage students to focus on gaining real world exposure as early as possible, including internships, volunteer work, part-time work, shadowing in healthcare. This can give you a great understanding on just how things actually work day to day within healthcare or any role or career that you want to go into. Getting involved in programs and organizations, they can help you build your soft skills. I like to call them essential skills. And so those are more like communication and kindness, compassion, teamwork, problem solving. These are just as important as all the technical skills. The more exposure that you get, the more confident and prepared you'll feel when you're transitioning into the workforce. Let's see. Previous experience matters. Lots of skills are transferable as far as, advice for transitioning into a career or a different career. Just, connect with all these skills. I think that it'll make it easier to do a switch or transition going into the workforce. Thank you.
Thank you. And next, Mazen and Kendricks.
Yeah, I'll take this question and kind of reiterate a lot of the things that Ines just said because they were great points. But yeah, one of the biggest lessons I definitely learned was that experience is key. Like my degree does mean a lot and can get me further, but I had to build experience on it in order to do so. Like employers are looking for evidence that you can apply what you learn to real world settings and situations. So while I was in school, although I wish I started earlier, I gained experience and lasting connections through being a TA, also tutoring different school organizations, doing study abroad programs, and even the 30 interviews I did after finishing school also helped me build, professional skills every time, as well as kind of figure out what careers I was interested in. So because of that, I encourage students to seek out like research projects, campus leadership roles, job shadows, networking experience, networking opportunities, like while you're in school, because those experiences are just as valuable as your coursework. And a way you can kind of get into these experiences is, of course, by talking to your teachers and professors, right? Visiting the career centers, attending those networking events, really joining student organizations and getting involved. Many of the opportunities come from being proactive and being willing to ask those questions and build those connections. Like for example, I have a professor that I went on a study abroad program with who still contacts me for potential job opportunities as well as professional development opportunities. So that's very cool. And advice for those looking into transitioning into a career is you probably are bringing more transferable skills than you realize. I transitioned from a background in teaching and history and went into workforce development. And I think one of the things that made that possible was my ability to market myself and my transferable skills like communication, training, problem solving, relationship building, right? So don't focus on starting over, focus on how your experiences can add value into that new field. So, you could even conduct informational interviews, attend industry events, right? Volunteering, something to gain exposure into that new field, because a conversation or an experience or something like that can really get you set on like a career path that you may not have thought of or even knew about before. And I think it's really cool that at San Diego Workforce Partnership, we're able to help young adults access those opportunities through services like internships, paid work experience, those job readiness workshops. And there's just, hiring fairs, job fairs, and there's people and entities that are there to help you through, career changes and everything like that. So you don't have to navigate that process alone.
Thank you. Laura?
And just to add on, I agree with everything that everyone has said. I think LinkedIn is a great tool to have. I've helped students create like a LinkedIn post that says, these are my skills, this is what I'm looking for. I'd love to gain experience in these things. And I've seen students get picked up for internships, for different job shadows, those kinds of, and for positions also. So I think LinkedIn is a great tool to have at your disposal. One thing that I also wanted to add is the importance of connections. I think that getting to know people is so important because you never know who's going to open that door for you or support you. And so for me, I remember one of my first jobs that I got, I had an intern there. And we had a great relationship, and then she moved on to San Diego State University to work. Years later, during the pandemic, I lost my job. I got laid off. And I reached out to her and I said, hey, I hear that there's a teaching position there at San Diego State. And she said, I'm going to put in a good word for you. And I got hired on the spot. And so I think it's so important to get to know every single person in your department, whether it's the finance person, the custodian, the lady that works in anyone can put in a good word for you. And I think it's so important because people trust what other people say. It's hard to really pick up a personality and a work style and a work ethic from the resume. And so when somebody does that extra job of helping you, like I know them, I work with them. They're a really hard worker. They're good. They adapt well to environments, those kinds of things. So I think for me, this was told to me a long time ago when I started working. This is back in 1991, maybe, that somebody told me relationships and connections are everything. So just be very aware of that. And let me see, is there anything else that I wanted to add to this? You just get to know people. I think that's the most important. Everywhere I work, no matter who's coming by, one of the computer techs, whoever around me, I always get to know their name. Oh, nice to meet you, because you never know what connections you may be able to build with them. So yes, that's my advice. Thank you.
Thank you. Thank you, everyone, for sharing and giving such insightful answers. For our next question, what skills are essential for success? What skills are essential for success in your career? And what's one unconventional skill or experience that has been surprisingly valuable in your career? And we're going to begin with Mazen.
All right. So, aside from the actual hard skills, the technical skills, um, the thing that I think is most valuable, that at least it has been for me, is being able to establish and sustain interpersonal relationships with people. Um, all of our programs here at San Diego Workforce Partnerships are grant funded. Um, so state gives us funding, we fund programs. Those programs train people, and then we collect data and give it back to the state. At the end of the day, that's the basis of how our program, our industry, or our business works, right? But don't get it confused. We're in the people business at the end of the day. Um, People are not metrics, right? We have to be able to build relationships with people and sustain these relationships with people because people come to us. Yeah, yes, there are some people who come to us that just say, "Hey, I want to advance in my career, and can you help me with getting this certification? I want to be able to do better, so can you help me take these classes?" But then there are some people who come to us when they are at their lowest points and saying, "Hey, I'm desperate. I need help restarting my life. I need help. I have little to no education, and I have all these barriers in place." We build and sustain these relationships with people to where they they trust us to have their best interest at heart. And we take everything that people bring to us, and we take that in and help them gain all those, whether it's the technical skills, help them build their soft skills, or sometimes, for lack of better terms, it's hand holding, right? Some people need that, they need affirmations, they need confirmation on, you know, just because regardless of what you have been through in life, regardless of what your starting point is at when you come to us, that you are good enough to go into these fields. You are good enough to complete these trainings. And there are a lot of people who come to us with a lot of barriers in place, whether it be financial, whether it be lack of transportation. These people come to us with all their hardships, and they come to us with almost hat in hand at times, right? And they come to us saying, "Can you please help me? I want to be able to better my life." And at the end of the day, that's what we do, right? We help people better their lives. So I can't stress enough the importance of building relationships with people and building not just surface level, "Hey, you come to me and to complete a task for you," to build these interpersonal relationships with people, because the more you care about somebody, the further you're willing to go for them, and the more you're willing to do for that person. And when somebody sees how much you care about not just your job, but that them in particular, like to somebody who comes to us in these situations, it doesn't matter to them that you successfully help 9 out of 10 people, because if you can't help them, then it doesn't make a difference, right? Our goal always is to be able to help to give full attention to every single person who comes in and is looking for our services, because at the end of the day, that's what we provide, right? Is relationships and services.
Thank you. Next is Laura.
I'm going to go really unconventional. So one thing I want to share is that in addition to working as a lecturer here at San Diego State, I own my own company. It's energy balancing and relaxation. And one of the things that I've gained from that is being in touch with my intuition. And I think sometimes we hear that little voice, sometimes we have that feeling, we may be afraid to follow it, but it's really, I feel like, guiding. And so I think listen to that little voice who's pushing you a little bit to try something new, to maybe step out of your comfort zone. I've had so many instances. One time I heard, or I had this intuition, reach out to the San Diego Padres about relaxation therapy. And I did, and they went for it. I would hear things like apply for a grant, and I would get the grant. And the last one was I competed for some money for another grant, and I was able to get that grant. But just from reading things and saying you can do that, and saying, instead of saying, convincing myself I shouldn't be doing this, this isn't for me. I would be okay, and I would try. And not everything, of course, works out. But one of my favorite authors, Gabby Bernstein, says obstacles are detours in the right direction. So even for me, even losing my job that I had been at for 20 years, provided me the opportunity to start working here at San Diego State, to open up my own business, to do all these things. So it may be a little bit unconventional to talk about your intuition and to just, to step out of that comfort zone. But I think that those are really essential skills that will serve you well in your career. Thank you.
Thank you. Elisa?
So I agree 110% with everything that's already been shared. And in addition, what I would say is, um, I would consider it definitely a skill or a trait, and it's to be brave. It's to be brave and be willing to take risks in whatever your role is. And when I say risks, I mean it's like volunteer. Volunteer and put yourself out there so that you're able to demonstrate to your coworkers, your colleagues, your boss, that you have the capacity and the interest to give and do more that exists outside of your job description. Be genuine, when you do it, and find something that is more within your traditional job role and start to grow while also giving. You're giving more than what's being asked for you to do on paper, and do it because you want to, not because someone's asking you to do it. And from that, you are going to be able to strengthen those relationships, like Maizen said, you know, and that is truly essential. The relationship piece and establishing trust. You got to be reliable, friends. You got to show up to work, and if you can't, be okay with having those transparent, honest conversations with whoever you report to and share with them your why. Maybe sometimes there is an opportunity that they can help support you, whether it's to navigate, say, through your current situation, or maybe it's potentially to explore a new opportunity that exists, maybe still within that organization or your place of where you're at right now. But that's all about communication. That's all about being comfortable with communicating with others. Don't wait to be asked to do things. Give your shout out, raise your hand, put yourself in places where you see that there's a need, and that's going to speak volumes about who you are, about your character as an employee and as an individual all around. I've got to say, those are things that I've done, which I really feel have helped me along the way to be successful and honestly to be happy in my role. You may hear about the term burnout, and it is real. And what I have discovered is that when I only focus on my job, what's written on the paper to do, I have a higher risk or a higher chance of experiencing burnout if I don't find something more within my job, within my employer, to give and do for myself, and to do for others. And so when I'm able to apply those skills and figure out where more I can do and where more I can be, that also helps reduce burnout for me. So thank you.
Thank you. In what ways do you see your field evolving in the next 5 to 10 years, and how can aspiring professionals prepare for these changes? We'll begin with Inez.
So my field evolving in the next 5 to 10 years. I think healthcare probably most likely is going to feel different and look different, all right, in the way we do things day to day. One of those biggest things is right AI. We're all using AI now. It's going to be a part of our everyday workflow. We're currently, it's helping us do things like scheduling and documentation, even decision support. That's one of the things is going to evolve. So maybe familiarizing yourself with it, learning how to use it within your day-to-day work or even life might help you a little bit because I think that is coming. Something else is, I think we need to be able to build people up, creating pathways, mentorship, opportunities. This way we can help grow our next generation of healthcare professionals. Because without that, who are we going to have out there in healthcare, right? So currently, we do have an externship and a mentorship program at Rees-Stealy, and we have a high school that has a CTE pathway program that's for medical assisting, and they're coming in and doing their externship. So we are shaping them and helping them grow within that medical assisting field, so that when they graduate high school, they are medical assistants and can be working within the healthcare field. If I could give advice to anyone that's starting out is, no one has a perfect plan. Things always happen. It's not a straight line. Mine sure wasn't, and I think it'll be good. Go for what you're, wanting to go for. Thank you.
Thank you. Kendricks?
Actually, Mazen is going to take this question.
Yeah,
Oh, yes.
I'll take this.
Go ahead.
So for ways we see our field evolving, um, well, because we deal with people, workforce development will always be in existence. Now that doesn't mean we need to stay that it's all that doesn't mean we need to stay complicit with how we currently do things, because it is always evolving, right? Our job is to stay consistent with to stay current with the landscape of the job market to ensure our participants to ensure we can keep serving our participants. But we also have to stay current with our demographics, right? The people we're serving today may not be the same people we're serving tomorrow. We can't be afraid to use AI at times, because we can use these different AI tools as ways to help us predict what the job market, not just what it currently is, but where we think it's going to end up being, and not just who we are currently serving, but we can also use it to help us predict who our incoming participants may end up being. There's these tools that, I mean, not tools, but terms that that get thrown around, that have been thrown around all the time, of white collar and blue collar jobs. But there's a new term where they're considered new collar, right? So with AI, we are able to we're able to find out what the current demographics are and what the current job market is, and we're able to use those to project where the market is going to be going. Right? We always have to stay, we essentially have to try to stay one step ahead of where the current job market is, because if we're currently training people for jobs that are going to end up becoming obsolete, well, then we're kind of doing them a disservice, right? Because then they're going to have to come back to us to get retrained. So we try to use these tools as a way to predict where the job market is going to be heading towards, and where our participants are going to be are going to end up in when those industries shift. Um, just within our industry itself, we definitely incorporate these AI tools. The days of employers reading hundreds of job applications and resumes are kind of a thing of the past. We use these ATS programs, which are our applicant tracking systems, of ways to help weed through some of these resumes and applications. So with our trainings that we offer, we help people to be able to almost bolster up their resumes and their applications, because these tracking systems are now just looking for keywords, right? And those resumes are what's going to get you into the door for a job interview. But if you can't even pass these these tracking systems, if you can't get through all the filters and everything that are set in place for these resumes, then you're never going to make it to the interview itself, right? So we help people to be able to figure out what should go onto on their resumes, what should go onto their applications, to be able to prep them for their applications for these new jobs that are going to be coming out. It's not just the current system that's in place now, or that has been in the past. It's sad to say, but it's essentially going to be obsolete soon, right? Because people need to be able to predict, and by people I mean us, right? As workforce developers, we need to be able to predict where the job market is going, so that we can ensure that our participants are staying on par with where the economy is going.
Thank you. Next question, please. What barriers did you face and how did you overcome them? We're going to begin with Laura.
One of the barriers that I faced was imposter syndrome. And I think just thinking, oh, they're going to know that I don't really know as much as I say that I do, and really um, being compassionate with myself and talking through some of these things. A while back, there was an opening. Someone came to me and said, Laura, there's an opening to teach Chicano psychology. You should apply. And at first I was like, I'm not sure if I'd be strong enough for that. What if they know? And when I went to the interview, the person who interviewed me had seen me as an advisor, had seen me with the math equity program, had seen me help supporting engineering. And as soon as they saw me, they said, I know you. I've seen you do a lot of things here on campus. I want you to teach the class. And so getting out of my head and knowing that I have these skills. I am capable of doing these things, and I think that's one of the barriers that I really have to be really aware of. That I can do all these things, and I'm a lifelong learner. Um, at the age of 57, I'm always still learning new things. And the second thing I wanted to share is that when I started working, I worked for the Girl Scouts, the Imperial Council, San Diego Imperial Council, and I was in membership and marketing. And in doing that job, it was my role to, of course, speak to the community and share how girls could get involved in Girl Scouts. But I also had to develop collaborations in the community, and I was sent to a bunch of chambers of commerce to go to mixers, and I was painfully shy at the time. And so I remember it was like, I don't even know if nails on a chalkboard make sense anymore, but it was just so hard for me to walk into that room and, hi, I'm Laura. This is my business card. I work for the Girl Scouts. Girl Scouts develop a conversation with people. And I had to go to Chula Vista and National City and Coronado and different chambers and different events that eventually that shyness went away. And I think recently I learned a quote, confidence comes through action. And I think just going in there, trying something, learning from it, maybe it's not the best experience, but you learn from it and being compassionate to yourself. I was able to overcome that imposter syndrome and the being painfully shy that I had to deal with. So that's what I want to share. Thank you.
Thank you. Mazen?
Um, well, so when it comes to barriers, because our jobs are not just employment for us, but also for our participants, I'll try to answer it on our participants side. Um, so we pride ourselves on helping underserved communities. Um, but I feel like that term kind of just gets thrown around a little too freely at times. Um, people just say we want to help underserved communities, and then that's it. That's all they say, and they wait for people to, we have all these services that we offer, and they just wait for people to come to them looking for those services. Well, those communities are deemed underserved for a reason, right? There are people who don't even know about these resources, let alone have access to the resources. So what we do is we have what we consider what we call supportive services. We make sure that all of our trainings, all of our participants in all of our trainings have access to these supportive services. And those supportive services are essentially ways to knock down different barriers for people to be able to enter these trainings and into our programs. First things first, all of our trainings are always free, right? Now, there are some that, depending on how extensive the trainings are and how long they are in the day, a lot of our participants aren't going to be able to hold jobs while they're working. So some of our programs offer stipends, like weekly stipends to subsidize the fact that you're not going to be able to work while you're doing these trainings. Um, so a lot of our participants can't make it to and from our training. So for those that have cars, we offer gas cards, which would be able to get them to and from either our training sites, or if they have, our classroom sites, or if they have field trainings, be able to give them enough gas to get to and from the field trainings. If people don't have cars, we offer MTS bus passes and trolley passes. Um, if these trainings are not just classroom trainings, because we do work with the trades, a lot of these trades have you have to come in with a certain uniform to be able, whether it's your PPE, which is like the gear that you wear, or if it's protective uniforms, whether it's helmets or different padding that you may need. If people can't afford those, we offer them gift cards to be able to go shopping for stuff like that. Um, if your training requires in classroom trainings and you don't have and you have trouble with electronics, or you don't own electronics, we provide laptops or iPads to be able to continue to be able to complete your trainings. If you have internet issues, we offer hotspots. If you come to us and say, "Hey, I have children, there's no way I can. I'm sorry, but there's no way I can make it to your classes, or there's no way I can make it to trainings every day." Well, we offer childcare, as we offer stipends for childcare, so that you can go to your class by day and then go pick up your kids afterwards. If people come to us and say they need help with I can't afford my training equipment, or I don't have money for the education materials. That's also included when we say our our education is free to our participants. We mean everything from the day you start your classes to the day you end, right? Our goal is to knock down any and every barrier possible to that people are always going to come to us with some type of excuse saying that, hey, I wish I could, but I can't because of this, right? That goes back to what I was saying about people being, these communities being deemed underserved. These people come to you. It's not just the fact that they don't want to be in these trainings. They don't. Some people just can't afford to be in these trainings. Some people can't afford to be in a free training if you tell them they have to pay for their own bus fare to and from classes every day. If you tell somebody you have to, yeah, the classes are free, but you have to come in with your own laptop. So our supportive services help knock down some of those barriers so that at the end of it all, it really just comes down to are you as a participant willing to put in the work to complete the course, right? Um, but any and everything else that can stand in somebody's way, we go the extra mile to make sure that those walls are knocked down, and that the only thing left for the participant at that point is completing their training and their education.
One of the barriers I faced was not really, um, thank you, Roslyn. But yeah, one of the barriers I faced was, I guess, not having a viable pathway forward, and I would say exposure. Growing up and as I was finishing high school, I thought the only way to be successful was to go to college, get a degree, and then a career would somehow follow after that. Um, but I love history. I'm very grateful for my educational experiences, but I definitely didn't spend enough time exploring careers, networking, or learning about the opportunities outside of the classroom. And also not knowing what resources were available to me. So, like looking back all through my undergrad, there was mentors, support systems that could have helped me. But I just didn't know how to ask questions or seek those out. And I think that's a big challenge that students, face today is you don't know what you don't know. And what helped me really overcome that barrier was being open to new experiences, saying yes to opportunities that would allow me to learn more about myself, and going out of my comfort zone to build my social capital, trying new things, and really getting involved. Opportunities will present themselves if you put yourself in the right rooms and in front of the right people. Um, and each experience taught me something new that helped me, kind of refine my goals. In my current role, I get to help, young adults access those opportunities and services that I wish I knew about, including like career exploration, work-based learning, career coaching, things like that. And so I've learned that it's really okay to not have everything figured out, but it is important to be curious, ask those questions, explore different paths, take advantage of the resources and the support available to you, because I didn't think I struggled, because my lack of ability, but I think I struggled because of my lack of exposure.
Thank you so much for those answers. Ines.
Um, barriers that I face and how did I overcome them? And I agree honestly with what everyone has said. Kendrick's especially because I think that the exposure definitely is key. Look for those job shadowing opportunities, um, network, join organizations, clubs with, depending on whatever career you want to go into. I think that that will really help um, you become those barriers. And especially, I am actually a little shy. And so I do struggle a little bit with getting out there and talking to people. But once I'm doing it, it's easier. So for me, I think that that is a huge barrier that I faced. And pushing myself to go and join organizations and volunteer and doing career fairs and talking to students and, doing this today, definitely helps me.
Thank you. I'm so glad you joined us today. All right. And so thank you so much to our panelists for all of the wonderful answers provided so far. We have some time for some questions, including questions submitting during registration. So please continue to put your questions in the Q&A box, and then we can answer them as we have time. For our first pre-submitted question from registration, what are the current impacts of AI on career pathways for young people? And Kendricks, you go ahead.
All right, thank you for this question. Yeah, so definitely a large impact AI is having on career pathways is that it's changing the way we prepare for work. So like entry-level jobs like tickets, cashiers, things that were traditionally young adult jobs entering the workforce are now automated, and people often focused on learning a specific task or a technical skill. Well, today those are still important, but employers are looking for people who can adapt, continuously learn, and work alongside those emerging technologies. So, like, your willingness to continuously learn and tackle those emerging and new technologies and programs will demonstrate your soft skills, such as adaptability. So like digital literacy, getting familiar with like Outlook and Google Workspace and stuff like that is all super important. But again, generative and prompt-based AI are going to be more important essential skills for everyone to learn and grow comfortable with. Um, like they even thought that construction, industries weren't going to be like affected as much as AI since it is more labor based. But in project management and everything, they're starting to use softwares and AI assisted equipment and drones. So now it's going to be less jobs in one sense, but new jobs emerging that are AI, but with humans in the loop. So I definitely would encourage young people to be curious about AI, right? Learn how to use it, be adaptable, and just again, work with those emerging technologies.
Thank you. I'll pass it over to Laura.
I just want to add that I think we're living through a really exciting time also for young people. There are jobs that haven't been created yet, and so the future is so exciting right now. So I want to look at it in a positive way. That yes, AI is going to take over some jobs, but there's going to be some new and exciting jobs that we haven't even heard of before. And so I'm excited for the future for that. Another thing that I recently went to a class that talked about really trust yourself. Don't depend so much on relying on AI to answer things for you. Trust your skills, trust your knowledge, trust what you know, and build off of that. And I recently went to a conference and Eric Rees was there. who is an entrepreneur, and he said, AI is not a substitute for human creativity, but it can enhance and augment creativity. So I think that as long as we're aware that we are the ones that are guiding, that we're the ones running things, that AI is going to be a support to us, but it's not never going to take away from the creativity that humans have, and our ability to do wonderful things. And so I think it's an exciting time, like I said, and I'm excited about the future. Thank you.
Yes, thank you for those thoughtful answers. For our next question, how has your career path differed from what you expected as a young person? And we're going to go back to Laura.
Well, it's definitely different. I think, as many people have said, it was not linear. It was just, as you grow, you think of different things that you'd like to be, whatever you're exposed to. Of course, my first one was a teacher. I wanted to be a teacher. Then I was always very much into helping others. I wanted to become a nurse. Then after that, I wanted to become a secretary. I graduated high school in the 80s, so these are the things that, that I was thinking about at the time, that I had an aunt who was secretary. Um, and so just things that happen in my life. Um, I would have never, if you had told me back in 1987 when I graduated high school that I would be teaching at San Diego State University and have my own business in a million years. So I think we're in a time where people don't really spend 30 years anymore at a job. We're at a time where people spend maybe 5 years and then they find something else and move on and might even pivot and change careers. And so, definitely not doing what I thought I would do. But what is funny is that a long time ago, when I was at Southwestern College, I said I wanted to be a business owner. And my professor said, maybe think about something different. That might not be for you. And I ended up opening up my own business years later. And so, what I want to share with people is that if you have a dream in your heart, and maybe it's really like out of this world, I say pursue it, and see what happens. And it might lead you to something even better. So, definitely not on the career path that I thought I would be, but I'm really happy with all the different people that I've met, the things that I'm doing. Every single day is exciting, and I am definitely a lifelong learner, and I still dream about getting a PhD. So why not? So that's my story. I'm sticking to it. Thank you.
Thank you. Next, Elisa.
So I would say that, when I initially chose to pursue nursing, I envisioned myself forever working in a hospital, taking care of the patients. And knowing now that the world of nursing and the career path of nursing is so much more. And more what I'm learning now is that I have the ability to be an advocate for multiple people. I have the ability, because of my chosen profession and my expertise, to be an advocate in the community, whether it's partnering with educators or whether it's partnering with our city councilmen to or going to Washington D.C. That's my goal, to go in February with the professional nursing organization that I am affiliated with San Diego National Hispanic Nurses. And because as a nurse, that is another way of how to take care of the people. And it's really being open to whether it's pursuing leadership or if it's pursuing education. My credentials are and forever will be, RN, and then there's so much more. And so I think that, until I was able to give myself the yes and the chance to begin this career, which that is first and foremost. So, tagging on to what Laura has said, if you've got a dream, if you've got a passion, don't let no one or anyone stop you. Don't. You may have that non-linear path, like Inez said, and it may feel like, oh, here's another barrier. It's not a barrier. It's a growth opportunity that's going to take you soaring to something so much higher. And so it's like when you view things through a different lens, through a more positive and optimistic lens, it's not what's happening to you, it's what's going through you and what you're going to be learning and gaining once you cross over, and achieve and accomplish what's being placed in front of you. So I think that that's, ultimately how my career path has allowed me to grow into something so much more. And I know that there's even more waiting for me out there. I just haven't discovered it yet. Haven't discovered it yet. So thank you.
Thank you. Our next question is, what kind of core classes are required for a career path in healthcare? And I'm going to pass this to Inez and Elisa.
Core classes, of course, it's, your basic science, your math, your English, communication, maybe even some psychology or sociology so that you can better understand people and behavior. But um, I go back to getting the exposure, the real world experience. Take classes like, getting your CPR, first aid class, volunteering at senior living facilities. That could help you kind of give an eye, firsthand look into what healthcare can be, taking care of people. You definitely have to love people if you want to be in healthcare, because it is all about, embracing the love of people. So, put yourself in places where you can do job shadowing, volunteering, and again, I go back to participating in clubs or programs, joining organizations that can help lead you into a career in healthcare.
Yes, and in addition to everything that Inez has said, there's classes that you of course, you can enroll in and take at school, medical terminology as well. I think that the most important skill set to have is being an effective communicator. And yes, you can go to school, you can learn that, through a formal class. And yet there's so many other ways on how you can engage with people, even how you can engage, in your own home, in your household, with your friends and your family, to be that active listener, to be an empathetic listener, to listen and enter into conversations without judgment. These are key things that you need when you go into healthcare, when you're either taking care of another human being because you don't know their story. Just like they don't know you, you don't know them. So, you know, being exposed more, as Inez said, to the world of healthcare can look so different in different ways, whether it's informally in a classroom or also pay attention to and start to network and look on your social media for local San Diego chapter professional organizations where you can start to network with them, whether it's and especially like if it's nursing organizations, we have the Black Nurses Association, we have the Men in Nursing, we have a San Diego Hispanic Nurses Association. We have all these chapters that are right here in our backyard, which accept and want volunteers. Takes nothing to be a volunteer. It's your own personal investment of your time, and that's going to start to get you the exposure so that you can see, is this a career that I want to pursue? How do I do, with interacting with complete strangers, and also once again, you putting yourself out there by submitting an interest, whether it's electronically or something that you want to volunteer, that's a huge step. So don't discount that. That's a huge step that is worthy of getting credited for it. It's also something you can put on your resume if you want to as well. So those are some of like the core classes, whether it's traditional class or non-traditional class, that I would say are required for a career path in healthcare. Thank you.
Thank you. And for our next question, what advice can I give graduating high school seniors interested in a trade? Do you have any advice for high school graduates deciding between college or trade school? And I'll pass this to Mazen.
Yeah, so the old approach to education was sorry, was you graduate high school, you graduate college, you get a career, you stay in that career forever, right? That's not quite the case anymore. There's no right way to approach getting a job anymore these days. Um, employers nowadays are valuing experience and trainings more than ever. Um, so what I would, what we recommend here is not to necessarily go in with just with one trade in mind, unless you know exactly what you want to do, right? If you go in saying, I want to be a roofer, right? You know exactly what you want to do. If I want to be an electrician, you know exactly what you want to do. Find programs that offer trainings in those specific trades. But if you just say, hey, I know I want to work with my hands and I want to be in in some form of some form of construction, right? You don't know exactly what it is you want to do. Um, we offer a program called ARP. It's an apprenticeship readiness program. So the what you end up doing when you go into these trades is you start off and you go directly into an apprenticeship, right? Well, what we offer with ARP is a pre-apprenticeship. So during that time, you're gonna get all the necessary accreditations that will work for any trade that's offered. But the beauty of ARP is it exposes you to so many different options and so many different trades. Um, we partner with the San Diego Building Trades, which means that when you take this course, you get exposure to all 23 trades that are offered through San Diego Building Trades. Um, so when you come in, again, it's a paid, these are you get all your necessary trainings to go into, once you complete ARP, which is the pre-apprenticeship, you can then select which apprenticeship route you want to take. And then once you select your apprenticeship route, these are for the most part all paid apprenticeships. Um, so once you commit a program like ARP, where you come in and you get all your you get accredited across the board for all the different trades, you then select you then select which trade you want to go into. And then once you do that, you go in and you apply for your apprenticeship. And these apprenticeships are, if you go in through the San Diego Building Trades, are for unionized positions. So that comes, you're not just going there and working, you're going in, you're coming in with full benefits, you're coming in with your full, the full backing of your union to make sure you are, if you, let's say you move out of San Diego, you can go find your same work in whatever city you end up in. But I don't want to make it sound as if, oh, let's just go through the trades. It's so much easier than going through the traditional college route, right? It's not easier, it's just different, right? There are different commitments that you're signing up for. Um, yes, we'll help you with your application process. We'll help you with your even while you're in your trainings, we can help you if there's anything that's in place that you're struggling with. But once you complete your pre-apprenticeship and you're going into these apprenticeship programs, they're not easy, right? Um, these are really well-paying jobs, but they're well-paying for a reason, right? Like there's a lot that's required out of you. There's a lot that's expected out of you. But it's all doable, right? And as long as you have the right trade in mind that you want to go into, the last thing you want to do is go through all this, pick one trade, go through the training, and then find out once you're in the apprenticeship program, after you fought so hard to get into that apprenticeship program, that you ended up realizing, I don't like this career path. And you have to start all over. That's why it's something like a program like ARP is so valuable, is because it exposes you to so many different apprenticeship routes that you can go into, that you can come in saying, these are my top five that I'm interested in, and you can end up leaving with something completely different. And that's the beauty of a program like this, where you can come in and do your pre-apprenticeship, because it prepares you for an apprenticeship within all the different trades.
Thank you. Okay. Thank you so much to our panelists and for all of your insightful answers so far. Now we'll take a look at our live submitted Q&A questions, and you can continue to add questions to the Q&A box as attendees, and we'll answer them as we have time. So one submitted question we had is, do you have any advice for recent graduates who want to start a career in healthcare clinic management? What kind of job titles should a recent MPH graduate be applying for in order to work in hospital administration? And also, what was your most valuable early career decisions or position? I will go ahead and drop that written so our panelists can read it, but is anyone interested in taking on this question?
I'll take that one. So I would recommend, because I work a lot with our MPH graduates and students at San Diego State. And so I would recommend that first and foremost, we try to get you into an internship, or a mentorship program. So that, because there's several different avenues as far as like what department that you could start as, whether it's say to be a supervisor, or a lead in whatever said department, to work your way up into a management position, like an actual manager or director position. And so several organizations, I'm aware of three that I've I've been an employee of myself up here in San Diego. They usually have different tiers, so that match with not only your degree, your MPH degree, but also with all the rest of your skill set that you have under your belt as well, and your experience and everything. So trying to find an internship or an externship, just, or even say a shadowing experience, so that you can get in and you can get to know, is it going to be maybe public health? I'm sorry, population health, or maybe it's going to be, say, even project management, or is it going to be actual in the day-to-day operations? So there's various different roles that with your, with your amazing degree that you could qualify for. It's a matter of you getting to know what those environments look like, and you being able to decide if and what's going to be the best fit. That would be my recommendation.
Wonderful. Thank you.
Mhm.
We have a participant that would like to share the resources and services offered by a peer support specialist. Okay, thank you. We can connect offline and share any links in our follow-up email from you. And Elisa and Inez, an attendee would like to know more about your role with Sharp. Elisa, I saw that you answered in the Q&A box that you're a nurse and the director of surgical specialty operations at Sharp Rees-Stealy. Inez, do you want to share a little bit more about your role?
Sure. My role is project coordinator for our patient care services team. We have several different service lines, for instance, like primary care, surgical specialties, medical specialties, and urgent care and occupational medicine. So I assist kind of in day-to-day activities, or some of the I assist with the programs that Elisa and I coordinate together, as far as like the mentorship and externship and placing and student placements. Um, my job role, is kind of broad. I have my hands in a lot of different pots. But, I help lead initiatives, I support operations, and just do kind of, a little bit of a lot of it in this role. Thank you.
Yes, thank you. And then we had a question that was, how can students who aren't in tech majors learn to use these tools? How can we show our non-tech background could be valuable? And for this question, Elisa shared some thoughts, but opening it up to the rest of the panel, how can students who are not in tech majors learn to use AI tools and tech tools? And then how can they demonstrate that their non-technical background can be valuable?
I can answer this question. Um, so I think that even in non-tech, like majors and everything like that, they are still incorporating different technology and like AI into those courses. Like for example, history, you don't really have to know anything about technology, but one of the classes they made it to compete with how careers and like things are changing is creating like a digital history course. So I think within non-tech majors, they will be exposed to different technologies and different softwares that are related to that field, which is nice. But also, there's a lot of different organizations as well as the schools themselves that put on workshops that have to do with technology and AI and things like that. Um, but as far as again, like marketing, or like how you can show that just as valuable if you not aren't tech focused, I think is really focusing on the human aspect of your, soft skills and technical skills and things like that, because again, those are just as important as someone who can prompt AI. So yeah, that's kind of my answer.
Thank you. Great answer. Um, and then we do have a question asking, are we able to share links or resources for ARP?
Yeah, so I saw the question. I already have it queued up. I was waiting till I didn't want to interrupt their answers, but I just sent the link for it.
Thank you. Can you go ahead and share it again? And this time do it to all audience members. I think now it just shares to us. Wonderful. Thank you.
Mhm.
Okay. Another question we have is, what is one resource you would recommend for a midlife job seeker or career pivot? Anyone can take this one. You can also have a minute to think.
Um, At San Diego Workforce Partnership, we have actual career growth series. And this is for a bunch of different workshops that help you figure out kind of like what you want to transition into. For example, you'll do career exploration activities to figure out what your personality and interests match with your skills, and then what careers you can move into that way. They also provide services for updating your resume and how you can make those skills that you had from different fields into something that can be presented as those transferable skills for the new field that you want to go into. So definitely any resources that we dropped in the chat for SDWP, such as the calendar link, those will take you to all the different events and workshops that help with, career transitions as well as career growth.
And I just want to add that I know that there are a lot of certificates out there that people can earn, human resources and etc. Also, there are free online courses like through Coursera and other universities that offer trainings. If you want to start taking some of those, I think those would be also helpful. And they look really nice to say, I took one through Yale University to add that to your resume, and it doesn't cost anything. So.
Thank you. Those are great recommendations. We have one last question that we have time for. Someone asked, can you share any summer internship opportunities that are available for community college students? And then we had another individual ask about opportunities for within healthcare, which I see that Elisa has already started to answer. So if anyone else would like to answer about internship opportunities, please feel free to take the floor.
I'll just reiterate my response that I had typed, which is that Sharp Healthcare has established affiliations with certain schools and colleges. That's part of the approval process for us to be able to support internships. So it is worthy of you, depending upon the school or college that you are attending, to ask your school advisor who they are currently affiliated with. It may be Sharp, it may be Scripps, it may be Kaiser, it may be San Ysidro Health. You don't know until you ask your school advisors, who they have the partnerships and already established affiliations with, because that's usually the first step in the process for anyone, particularly in healthcare, if they want to have those opportunities. Thank you.
Another good resource for internships is Handshake, which a lot of community college students are already attached to. But you can look for internships on there. And also Mesa College has actually a search on their website to find internships. So those are also two places.
And I was just going to add, putting a post on LinkedIn also and putting in your interest that you're looking for an internship, that these are the things you're looking for. You'd be open to, commuting somewhere or working online. Just explaining yourself, adding a picture and maybe just some of your skill set, I think is always helpful.
Thank you, everyone. All right. Thank you once again to all of our panelists, Kendrix, Mazen, Laura, Elisa, Inez. And before our announcements, we'll ask that you let us know what you thought about this webinar and the information presented. We'll add the link to the chat, or you can scan the QR code to complete this 2-question feedback form very quickly. And the survey will just say, I learned something in today's webinar that helped me in my community and organization. And it also asks, what will you do with the information you learned today? There are no wrong answers. We'll give 1-2 minutes for you to fill this out. And if there are any other careers that you are interested in, please let us know. We'll give you a moment to scan the QR code or go through that link. Thank you for responding to the feedback form. We'll also send it out in our recap email. Your insights are incredibly helpful for us. And once again, thank you so much for joining us today. For our upcoming events, we have our in-person event, Beyond Burnout, focusing on well-being and a high-performance culture in a couple of weeks. Then in July, our next webinar will be Designing Compassionate Communities. For more information and to register, please visit our Virtual Connection Hub website. This page will be updated with today's recording as well. And if we missed your question today, please email us. As always, you can stay up to date with webinars and resources like this one today by subscribing to our newsletter as well. The link is in the chat. And that is all our time together today. Thank you so much again to everyone for joining us, and we hope to connect with you again soon.
Thank you. Bye-bye.